One legitimate concern about turbinate surgery is the small risk of empty nose syndrome. This is a huge subject that leads to very strong opinions and emotions. Fortunately, I've not seen any cases of empty nose syndrome even in my early career over 20 years ago when I was doing more aggressive turbinate resections. And interestingly, as part of our field, we occasionally perform what's called a medial maxillectomy, where the entire side wall of the nose, including most or all the turbinates, are removed for potential cancer. As far as I know, there have been no reports of empty nose syndrome in these patients. Another interesting finding that I saw in my practice was that in every patient that came to see me with an empty nose syndrome diagnosis, they all had severe upper airway collapse with their nostrils or further downstream in the throat, whether it was a soft palate, tongue base, or epiglottis. Many of these empty nose syndrome patients' symptoms looked identical to what's called UARS, or upper airway resistance syndrome. With a few exceptions, the few dozen or so patients with ENS responded relatively well by treating their UARS. My theory is that by dramatically lowering nasal resistance, it leads to increased airflow, which can narrow a collapsible tube either upstream or downstream. It's like sucking in through a flimsy straw. The harder you suck in, the more collapsible the straw becomes, especially in the weaker areas. And this can lead to sudden microarousals causing sleep fragmentation. Technically, these obstructive episodes won't be for more than 10 seconds, so it doesn't show up as apneas on sleep studies. Over the past 20 years while I was in practice, I saw more and more persistent nasal congestion despite turbinate surgery. I think ENTs in general, including myself, shifted over to more conservative options with better technology. But did this happen at the same time that awareness of ENS increased because of the internet? There are now even some sites that caution against touching the turbinates at all, even using the most conservative procedures. I can see why surgeons are being overly cautious. Patients who suffer from ENS have legitimate symptoms, and we need to take them seriously. It's odd that ENS was much more rare 30 to 50 years ago, and now it seems to be much more common. Is it because of the internet? Perhaps. However, if you consider the fact that modern human faces and nasal cavities have shrunken significantly over the past 50 years, it's no wonder that we're seeing much more of this condition. This video clip is from my more in-depth training revealing 7 long-term ways to clear your stuffy nose for good. If you're tired of trying all the tips and hacks you find online that only works for a few minutes, watch this video right now.